Hi, welcome to You and Your Health. I'm your host, David Bertone. We're back for our third season of You and Your Health, where we bring topics regarding health and well-being to you here locally in Old Bridge. Today's topic, we're talking about chiropractic care and treatment of the neck and headaches. It is an interesting concept and an excellent way to resolve some of the problems that people are having regarding their neck pain and chronic headaches. Our guest today is Dr. Jeffrey Ben-Ezra. Dr. Ben-Ezra practices in Hazlet at Ben-Ezra Chiropractic and Wellness Center. Dr. Ben-Ezra, thanks for coming.
Thanks for having me.
All right.
I appreciate it,
Tell us a little
Dave.
bit about your background. How long have you been practicing?
Oh, excellent. I actually started in practice down here in Hazlet in 1995. And prior to that, I worked in New York City on the Upper East Side for several years with Dr. David Rowe, where I learned a tremendous amount, and it was wonderful. We were up near the big research hospitals in the city, and we got to interact with a lot of the physicians in that area. And so here we are 15 years later, and it's been a tremendous ride.
And recently your practice has been primarily in Hazlet?
Yeah, for 15 full years in Hazlet, New Jersey.
Great. Okay, we're going to talk today about neck pain and in particular the treatment of headaches utilizing chiropractic techniques. Just for the audience, just so people understand, and there are obviously some misconceptions out there about chiropractic. What is chiropractic in general, and how can it help people with these kind of problems? Sure.
I think in general, the biggest misconception of chiropractic is we're there and we twist people's necks, and they don't understand what we do. We just make noise. Okay. And I can understand that because it's what they see on TV. But I think the most important thing to realize is that we're a natural healthcare profession, and that we really look to try to find what the cause of the problem is, underlying the disease, whatever name it might be, and try to remove interference from the body that might be causing it, from the brain down to the body, which runs everything. And so that's our main goal every day when I go to work, is try to find where the interference from the brain through the body to that particular area is, and open it up so that there's better traffic flow.
Great. Now when somebody comes to you for the first time and they have complaints of neck pain or headache, just say in general like chronic pain, what should somebody expect that first time? What is it that you would do, or some of the questions you would ask?
You know, that's a terrific question, because people come in, I'm sure as they do with your office as a physical therapist, and they're scared and they're nervous, and they really don't have any clue what might go on unless their friend referred them over, or their medical doctor. So the first thing we do is try to decide if they're in the right place. You know, is this something I think I can help you with, and that is worthy of your time on a repeated basis to help you? So we will do a full exam, and that includes a neurological exam. So we're checking their reflexes, checking their eyes to make sure that they're functioning well, especially in a headache type of condition. We're looking at higher function, which may include different parts of the brain, which is the cerebellum, for balance and communication processes. And then we're checking their range of motion in each vertebra along their spine. In this case, it would be in the neck, in the shoulders, and in the back. And then we'll do an orthopedic exam, which is to check how are the bones doing. Does it feel safe to even work on, or do they need an orthopedic person in there? Do they need a physical therapist to work with them as well, you know, conjunction with us? Or do they need a neurologist in there?
Now, do you typically do any testing that first day? In terms of you know you do the clinical testing, any other special testing that's required?
For me, especially if they're having headaches, we will look very closely as far as their neurological functions. It tells me a tremendous amount about what's going on with them. And that's looking at the eyes closely. And that's me specifically. It doesn't mean every single chiropractor is going to do that, but it's one of the things that I've been trained to do. If they need diagnostic testing, further testing, and I feel like they haven't been through enough proper testing yet, maybe they just came to me off the street and they're just on their first stop, then I might send them out for an x-ray up to the local hospital where they have an excellent radiology department. And from there, if we need further, we might send them for an MRI, or we might send them for an EMG, which is a test a neurologist might do. Okay. So we're always trying to see what's safe first, and then what test is going to help them the most and get the best bang for their dollar and time.
I think that's important, because these days with healthcare reform and healthcare dollars, people are a little bit more cost conscious. And somebody that may have a chronic headache or a chronic neck pain, they may have used to run to the emergency room for treatment, or a neurologist or their primary doctor, and they got through tons of tests, and then nobody really helped them get better. So what you're saying is you're kind of coming from the natural approach and try to treat them immediately when you first see them? Is that something that you normally
If
do?
it's something where I feel like this is an uncomplicated case, they're safe, I'm seeing no situation in them where I think, what would I want my mom being treated like, honestly, you know? Then we can start to do some light maneuvers with them where it wouldn't involve a spinal adjustment right away, but it might involve working on their soft tissue, loosening up their spine, getting them more supple, where they'll respond very, very well to that, but it's in a very safe manner.
Okay. One of the important things that I do with these patients, and I'm sure you do as well, is assess their posture, right? I mean, with neck pain and headaches, we see people all the time with their head kind of sticking out and really slump sitting. Is that something you see as well?
Yeah, and that's the pleasure of working with someone like yourself. And we've had the pleasure of working with each other and the patients back and forth. And it's such a difference when you're looking at someone's posture, because it kind of gives you a view of what's their daily life like if they're walking slumped in. Wow, you better start addressing that, trying to reel them back in. And I'm sure you see this and you can speak to it. It loosens their whole spine just by changing their posture.
Absolutely.
And what are some of the things that, so I can learn from you that you'll look at in that, which will help me clinically with the patients?
Yeah, I think any time that the head is protrudent in front of their shoulders, you get a lot of compression to those nerves in the back of the base of the skull. And I see that quite a bit. So I'm re-educating people all the time about sitting tall, chest up, not necessarily head in, but chest up, and keep things in line. So I think that's really important, especially for this classification of patient.
It is. It's tremendous, and you can see the difference in patients that come from your office, and that might just come off the street. They're already paying attention to that type of thing.
Absolutely.
Yeah.
Now let's talk about some of the terminology that people hear in terms of chiropractic. You use the term adjustment.
Yes.
What is an adjustment? What is a manipulation? Is it the same thing? And what is this term subluxation?
Okay, terrific. So first, start with why would you even do an adjustment or manipulation? And it is to correct a subluxation, which is, you said it correct, which 90% of the people don't, so I appreciate that. But a subluxation is, to us, that's the thing as a chiropractor that we look at in terms of, can I help you or not? If someone comes in and we can't find the subluxation, they're not a chiropractic case, and then we would be looking to refer them, whether it's to physical therapists first, in my case, orthopedist, or whatever they might need. So that term, in keeping it simple, is a vertebra that's misaligned itself to the one above or below it. And now it's creating torsion along the spinal cord and maybe impinging nerves where they have to flow out from the brain down. And it's simple. If there's miscommunication or if there's pinching on a nerve and there's torsion in it, the person can't be as healthy than if there was a clear pathway there. So if that helps to answer it pretty clearly.
Yeah, absolutely. So you would use these adjustments or manipulations to correct the position of the spine?
Yeah, and as the research has gone on, and I'm sure you know this, it's not so much that we're saying we're going to put this block on top of this block and it has to be in perfect alignment. That's the old style of thinking before we had all these new tests. But we're looking to create motion. We're looking to create a sustainable motion, which is what keeps people young. And the adjustment in our case is what does that, and we call it an adjustment in chiropractic, which means a lot to me because it's specifically aligning two vertebrae to get them moving and not just trying to do a global manipulation, which we also can do, and you're trained in very well as well. So there's a difference between what we're trying to do with two specific vertebrae and then maybe on a global scale.
So you're not necessarily trying to get it perfectly aligned. You're trying to get, and you're talking vertebrae that sit right on top of each other, and there's very minimal movement there, but you're trying to create a balance. And it may not hold that position, but you're trying to get motion in there. Is that what you're saying?
Yeah, and the exciting thing that's happening in the field now is we realize that if joints are stuck and not moving right, they have scar tissue in them, and then they are pre-wired for pain. And so if joints are stuck, it increases pain receptor firing to the brain, which increases spasm on the way down and makes the muscles weak. And so if we can do the opposite of that, which is what both you and I try to do, and we create motion, we're creating life, which lights up the brain in a good way, and decreases pain, decreases spasm, and increases strength.
So in particular, for somebody with headache complaints, what is it specifically that you're looking for there?
It's terrific. First thing, people come in and they say, I have tension headaches, or I have cluster headaches, or I have migraine headaches, and they're all classified as differences. Again, first thing, are they safe to take care of? And then once we move past that, we are looking to say, what's causing the tension on these nerves? And a lot of times in the neck particular, as the spinal cord travels from the brain through the skull and into the top portion of the spinal canal, it's actually, the spinal cord is actually attached by little hairs or ligaments to the vertebra on the inside of the canal. And this often, now if you can picture that, these are attached like little hairs like I have on my head, and now this vertebra is stuck out of alignment and actually stuck and not moving. You're getting direct tension on the spinal cord.
Okay.
So what are we trying to accomplish? Relieve that tension on the spinal cord. Get better spinal flow of the cerebrospinal fluids. Let the blood flow up and down the spinal cord better, and you know, watch what happens. It's pretty amazing.
Okay, so when you're doing these adjustments or manipulations, I mean, the public, again, they typically think of cracking and popping. Is that always necessary?
No, absolutely not. And at first when someone comes in, like today I had a patient in the morning with a terrific migraine, it might be the last thing that I think to do until she's ready for it. Okay. Whether it happens today or tomorrow or the next day, because we can always do that when the timing's right. So when I first start with just proper stretching of the spine and getting it moving, and I'm always trying, for me personally, what's comfortable for the patient and to soften their spinal cord so that the tension comes off.
I think one of the important things I know you do is the education component, and quite often in the medical profession they're so busy and they're not telling them exactly what's going on or what can be done or what they can do themselves. I assume that's an important component, right?
I think it is. I think people come in so confused and they want to know what they have more so. They're so used to wanting to know a diagnosis, which is interesting because the word di means two and agnos means don't know. So when you go and ask the doctor, what's my diagnosis, I kind of laugh sometimes because now it's two people that don't know.
That's good.
So I am always looking to say, what's the cause of it and how can we help bring about a clearing of that cause, and then all of a sudden you return health and you're not so much worried about the diagnosis anymore, but we're educating them on how do you stay healthier.
Good, good. Let's talk before the break about some of the precautions to manipulating or adjusting the neck in particular. I know it's kind of an area that it can be dangerous sometimes. And what are some of the precautions you look for?
Well, first off, you're trying to put people in an age category. You know, and you would do it with, if you had an older car, you would drive it different than if you had a brand new sports car, Ferrari, and you knew you could take it out on the road and drive it 150 miles an hour because it was safe. So first thing I'm looking at is, what would I do for a baby? How would I take care of a person, you know, 5 to 10 years old, and then someone in their teenage years, and then a senior? The most important people we have to be precautious about, of course, is seniors. One, because you have all different kinds of threats that they can come up against, from cancers to Parkinson's to tumors in the spine, out of the spine, in the brain. And you want to make sure that you did a good diagnostic work up there. So half of the battle in keeping people safe in any of our professions is, for doctors, is trying to rule out by age category what you might have to look for.
Are there any specific things like occluded vessels in the carotid arteries, or osteoporosis, say, osteopenia?
Absolutely.
Any of those kinds?
You know, when someone comes in and they have, again, age category, right, and you can't be fooled only by that, but you're looking at, if they have an osteoporosis problem, there's no way we're going to go in and use the same adjustment or manipulation, because, you know, it wouldn't be the proper thing to do for that person. So we do have instruments to adjust with that will help to move the spine and get it flexible again without any danger to the patient, no matter how osteoporotic they may be. Occlusions to the spine are a biggie these days because people don't eat so well, and so many people do have occlusions to the spine, or actually the blood flow would lead to a stroke potentially, where someone's getting their hair washed at a hairdresser and they have their neck over. It's one of those huge precautions that a hairdresser has to worry about, or a dentist when they're cleaning their teeth. So we tend to go very gentle on these people. Tend to use instrumentation to adjust them rather than manipulation by hand, and do the right thing for that particular patient.
Great. Okay, when we come back, we're going to talk about some of the typical pain generators seen in the neck and discuss with Dr. Ben-Ezra a little bit more about chiropractic care and the treatment of people with neck pain and headaches.
Hi, how are you doing today?
What looks good?
Our special today is shrimp scampi. It's been sitting around for about a week.
Don't you wish there were warnings to protect you from life's risks? With diabetes, there is one. It's called A1C, a simple blood test that helps measure your risk of serious complications. Learn more at diabetesa1c.org.
Welcome back to You and Your Health. I'm your host, David Bertone. Our guest today is Dr. Jeffrey Ben-Ezra, a chiropractic physician locally here in Hazlet. Dr. Ben-Ezra, thanks again for joining us.
Thanks for having me. It's been a great time.
We've talked about chiropractic care for neck pain and headaches, and we're going to go into specifically some of the typical pain generators that people see in neck pain, or what we term cervical pain. The first thing I would like to talk about is the facet joints, or the small joints in the neck. Can you describe that, and why is that a typical pain generator?
Oh, sure. The facet joints sit behind the spine, towards the back of the spine, and they, in the front you might have a disc. So if we have two vertebrae standing on top of each other like Oreos, and the disc is in the middle, the facet joints are in the back, and they're more on a plane like this, here. And they do a lot of the, just like your legs, holding you up, and also helping you with neck flexion, extension, and a little bit of side turning. They have a little disc inside them as well that most people don't know about, that you and I do, and those guys are full of pain sensors and pressure sensors. And they tend to scar up a lot on people that have been in car accidents, or going down slides and landed on their head when they were little kids, or maybe boxed when they were kids, or wrestled, or anything like that. They've taken a lot of wear and tear, and they tend to cause a lot of pain.
Now, would you typically see tenderness over those joints, or would they send pain to other areas?
You know, that's an interesting question. They start off usually with very much sensation to tenderness when we just touch them. But then as they get older in how long they've been there, and you touch them, you can vouch for this, those guys fly, and those pain can start up way high here in the neck, and the people might be complaining of pain way underneath their shoulder blade and not even know it's coming from their neck. Okay. Would you vouch for that?
Absolutely. So that would be an area that you would look at in terms of mobility, or restricted mobility at those joints, because as you said, there's a disc there, and there's some capsule and some nerve endings and stuff. So you would focus your adjustment in that area? Yeah,
okay. and the adjustments are really designed to go along the plane of the facet joint, meaning you don't want to go into that. You want to get that moving and walk through the door rather than walk into the door. Yeah. And what a difference you make in people when you can free them up. And it really helps the physical therapist after we get done, when we can get that moving, and then you can get the whole muscle area strengthened around that.
Yeah, it's a good combination, and we'll talk about that. Another pain generator in the neck that can commonly cause headaches or referred pain, sometimes into the head, are trigger points. What is a trigger point? Let the public know. What is a trigger point, and how can that be a pain generator?
Sure. Trigger points are areas along muscles, and they can be a small little muscle that is in between each spinal joint, or it can be these long muscles that you see in people with the long necks. And inside what we call the belly of the muscle, there gets to be an overwired area where they've had a previous injury, and now the body builds nerve endings inside there, inside scar tissue. And when you try to move it, one day you just wake up and it's sore as a dickens. And when you touch that as a provider, or as a doctor, or physical therapist, it just causes radiating pain into different places, far removed from that particular spot. And we work hard to get those trigger points to open up and to soften, and all of a sudden people start feeling a lot better.
Exactly. And again, another important component of those trigger points are the repetitive postures that people sustain. And we see them more in those postural muscles, the back of the neck muscles, from them holding their head forward, because they're working so hard to hold their
Now I was going to ask you, when you're seeing people that work at computers very often, and now you have to exercise them, what are some of the tricks you've come to help them with their trigger points and to reduce that tension?
That's a great question, and I'll typically teach them things to do right at their workstation to change their postures. It's really the cumulative effects of the strain on those muscles that cause the problem. So you need to interrupt that cycle. So if you're doing something like this 500 times a day, you want to take it and go in the opposite direction periodically, and it just relieves the pressure on those tissues. And that's the way to prevent trigger points. But in terms of treatment, you know, we do similar things in terms of deep cross-fiction massage. We use some electrical stimulation, ultrasound. We align the joints. Acupuncture has been very beneficial for real chronic trigger points, right?
Sure,
if you have good success with that. So that is really a typical pain generator in neck pain and referred pain into the head. And there's been a lot of research that has proven that certain trigger points and certain muscles have a pattern of referred pain. So we can look at that and say, well, this person's getting headaches on the side of their head. It's typically coming from this big muscle in the front of their neck, so we would address
yeah,
that area.
and they almost think you're nuts when
Yeah.
you start telling them that they're having this huge headache, and you're going, yeah, it's from here.
Yeah, yeah.
Until you press on that,
Yep.
and they go, oh, yeah, that's it.
And the nice
So
thing
it's-
about it is people usually get immediate relief with that, and then that's kind of a diagnostic procedure as well.
True.
Because you know you've gotten the spot.
Yeah.
Let's talk about some traumatic things, traumatic causes of neck pain, like traumatic whiplash.
Sure.
That you probably see quite a bit of in car accidents.
I do, and for me, it's unfortunately a lot of it. Since we have a large practice in the area for 15 years, it's a lot of the people that I know already taken care of since they were little, and now they start driving and they get in car accidents. And I just had one this past week. And the thing with a whiplash that people don't understand is that sometimes it's the small accidents that cause a tremendous amount of problem. And they think at the beginning, when the police arrive on the scene, oh, it's no big deal, I'm fine. And several hours to several days to several weeks later, I'm sure you've seen it, they have to reassociate it with all I did was get tapped. And what they're usually doing is knocking those facet joints for a loop that we just spoke about and causing a real stretch on that spinal cord so quickly that the body can't handle, and they weren't able to actually use their muscles to stop the injury because it did happen so quickly.
And do you see also a pain generator being the ligaments of the spine at that point? Because it is kind of it's not necessarily just a violent forward, but then it's the violent back. And it seems to stretch a lot of the controlling ligaments in the spine.
It's true. It gets to that deep core ligaments that go up the front of the spine and down the back of the spine, which are very much like strong duct tape, going all along the front and all along the back. And it's that quickness to it that I tend to, like I described it this morning, you could stretch taffy slowly. But the only way you're going to break it is if you snap it quickly. And it's that violent snap, even in a small 5-mile-an-hour accident, that causes much of the damage in a whiplash.
And I think it doesn't get enough credit in terms of what you do for these particular patients. But, you know, it's a soft tissue problem. It's not, there's no, typically, thank God, no fracture or there's no cuts or bleeding. And people can't see it and they say, what's wrong? You know, they had a little fender bender. They went 5 miles an hour. What's wrong with their neck? Why do they got to go for treatments for so long? Can you explain that? Why it takes so long for these people to get better?
You know, it's funny because in the insurance world, they use that, especially when I've been in court for people, oh, it's just a soft tissue injury, which is, I think to them, then why do people go to the gym? Because all they're doing is building soft tissue. That's what they want to build. And what's the brain made of? Soft tissue. Oh, just the brain. So the key thing with it is that these ligaments and the discs do not get good blood supply. So they have a very difficult time healing, and it takes repetitive visits to the chiropractor, the physical therapist, to get these joints and muscles and ligaments and the spine itself realigned and back in a good pattern of movement, which we said before, if there's lack of proper movement, it increases pain receptors. So you want to get the movement back and the spine strong, and then they all of a sudden can heal.
And these soft tissues typically just take a long time to heal versus if there's a fracture in a bone, you immobilize it in a cast or something, it heals in 4 to 6 weeks and people are fine. But the soft tissue is not so easy to heal because of the stress of daily life, postural stress, and all the other things you put on. It never really gets a chance to calm down and heal properly.
Yeah,
right?
and the interesting thing is if you do immobilize soft tissue, it usually gets worse.
Yep, exactly. So you don't want to use things like neck collars for long periods of time, right? Do you see that in your practice?
I am not a fan of that personally because then we know they need more therapy because now you have to increase the strength in the muscles, and they did build scar tissue when it was immobile.
Yeah, so the neck collar for the treatment of whiplash, maybe for a day, 2 the most, to let things just calm down, but for people that are wearing it for several weeks is dangerous because there's just so much atrophy and stiffness that develops.
Yeah.
Unless, obviously, it's indicated and it's a rigid collar for a fracture or some other thing that's been diagnosed. I think it's really important for people to be aware of that.
100% on the same page with you on that.
Good.
Seen many mistakes with that.
Let's talk about the follow-up care. So you've been seeing a person for a while with headache or neck pain. They're doing better. They seem to have less pain, less frequent neck pain, more mobility, less frequent headache. What is your follow-up with these people and the so-called maintenance routine?
Sure.
Can you just talk briefly about
Sure.
that?
Yeah, it's great you said that, because one of the things people think about when they hear the word chiropractor is once you go, you have to go forever.
Mm-hmm.
And I kind of chuckle at that, because I think to myself, well, you don't have to do anything you don't want to. This is America.
Mm-hmm.
We're not forced to do anything. So no one comes into me that has to do anything. They're choosing to come because they get a benefit, just like they are to you or to the gym or to any restaurant they go to.
Mm-hmm.
But what we're trying to do is actually wean them off of us.
Mm-hmm.
At least in my office, the name of the game is how fast can we get you well? And then I find that some people will need ongoing care because they've had such an injury where it can't get fully stable. And they will need some type of care, whether it's on a monthly basis or bi-monthly basis, just like you go to the dentist to get your teeth cleaned. They will need some kind of ongoing care if they choose.
Mm-hmm.
And other people say, I'll just take a Tylenol for that. No thanks, I'm not interested in that. And they never get badgered, and our door is open, as I'm sure yours is.
Mm-hmm.
But the name of the game is how fast can you get them well, get them stable, get them exercising, and so that they can take control of their own body and need less care of all of us. Because if the future is less cost in healthcare, then the people that win as providers are going to be the ones that have people spending less money, not more.
Exactly. I agree 100% with that. And we practice along the same philosophy. We get people better, we educate them as to what to do, and we send them on their merry way in hopes that we never see them again. Because we don't want them to have those chronic pains and headaches, and then that way they refer other people to get better as well. But I think there is some misconceptions at times for people that need, sometimes the chiropractic physician will say maintenance therapy for the next 6 months or 3 times a week, and,
Right.
and I don't think that's really good. And I think it's important that people understand that it needs to be indicated, and people need to have symptoms associated with it, and the physician needs to agree with that. Do you agree
Yeah,
with that?
you know, and the thing is, why are they coming? If someone's coming to stay loose and flexible, and our job is to find the subluxation, correct it, if they come in and we find that, then fine, you will work on them that day, at whatever pace that may be. And if they don't have anything, then as far as I'm concerned, hey, you're doing great today, you know, pop back in when you need to, or in a month or 2 months, and we'll check you again. It doesn't need to be an expensive, ongoing, forever thing.
Excellent.
And people in my office know that, and they know when they benefit. People that work at desks understand that. They need more than a person that's out walking around for a job.
Great. Dr. Ben-Ezra, thanks for joining us today.
Pleasure.
Really
Thanks for having
appreciate
me.
it. All right. So you've been watching You and Your Health. I'm your host, David Bertone. We've been speaking today about neck pain and headaches, and I hope you learned something that will help you resolve some of these symptoms in the future.